Treatments for OCD, drugs, specifically antidepressant and anti-anxiety drugs. Anti-anxiety, diclozapine, it was originally used to treat tuberculosis, however, now is a sedative for OCD sufferers. It can lead to new patterns of learning due to the control and lack of stimulation it allows. However, as said before in the schizophrenia video, drugs like this that allows for sedation can be seen as a form of social control, due to it being seen as a chemical straitjacket. Benzodiazepines, for example, Valium and Librium, these increase the activity of GABA, quieting many neurons in the brain. GABA reacts with GABA receptors on the postsynaptic neuron, inhibiting neurons to be stimulated by other neurons. This enables the individual to feel more relaxed. Antidepressants, SSR, fluoxetine, Prozac, Proexene, Parallax, and Zoloft, Sertraline. SSRIs treat both the primary symptoms of OCD as well as the secondary comorbidity depression. This reduces the reuptake of serotonin into the presynaptic neuron, increasing the amount of serotonin in the synapse. It blocks the transporters, increasing the stimulation of the postsynaptic neuron. Tricyclics, TCAs, they work as the same way in serotonin, but also increase the amount of noradrenaline in the synapse. Noradrenaline is associated with emotion, particularly mood control. Noradrenaline is involved in the function of sleep and dreaming, as well as learning. So if you don't know what desert is a useful way to evaluate treatments. It stands for direct, effective, side effects, slow/fast, ethical, relapse rates, and types of people. Direct. Psychiatrist decides the type of medication, for example SSRIs, the dosage and any changes. The patient has little control and mainly follows the medical instructions. Therefore, this is a direct type of treatment. Effective. Sumo et al. 2007 compared SSRIs and antidepressants with a placebo drug. The drugs are more effective than a placebo, reducing the amount of symptoms. This shows that it's reliable and effective. Side effects. Nausea, headache, anxiety, leading to self-harm and increased risk of suicide. Monitoring the patients whilst on antidepressants and anti-anxiety drugs is required. Slow. This treatment is a slow type of treatment. Corian et al. 2000 found that antidepressant medication had a long-term effect compared to placebo and was better at preventing relapse over an 80-week trial. SSRIs take up to 12 weeks to work. Ethical. There's a publication bias where results of drug trials are more likely to be published if they have positive results. Goldcare 2013 found that drug companies were selectively publishing positive outcomes for drugs their sponsors were selling, which is deceiving. Relapse rates. Stopping the drugs later carries on a high risk of relapse. Corian et al. 2000 and Roman et al. 2001 showed that 17.5% and 21% of relapse rates, respectively, when a drug was continued, and 38% and 59% respectively in a placebo group. Types of people. Comorbidity disorders are much more likely to be offered drugs due to it being easier for them to do than CBT due to needing motivation for CBT.